Hello and welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Evan, an exercise oncology instructor, and in today's conversation, we'll be talking about screen time and digital wellness. The information in this video is for educational purposes only, and it's important to consult with your medical team for more in-depth guidance and advice. As always, following our conversation, stick around for some gentle movement. We've all been there, whether it's scrolling through social media, checking your email, reading up on recent news, or even just watching TV. Our screens tend to catch our attention more than they should. Since the rise of widely available smartphones, excessive screen time and even screen addiction has become a growing issue. Despite various reported negative side effects, some are still unaware or ambivalent to the downsides of excessive screen time. Despite how often most adults are online, it's been reported that limiting social media use to 30 minutes per day can lead to a significant improvement in well-being. This statistic comes from a 2018 study published in the Journal of Social and Clinical Psychology and demonstrates the potential negative effect on well-being associated with social media, one of the main contributors to screen time for many. Various negative effects have been linked to excessive screen time and social media usage. However, some of the most prominently reported effects are sleep disruption, increased perceived stress, shortened attention span, depression and anxiety, sedentary behaviors, and addictive behaviors. Before we dive deeper into some of these side effects, I'd like to first touch a bit on depression and anxieties linked to excessive screen time and social media usage, as it's already a commonly reported symptom for those who are undergoing cancer treatment. Excessive screen usage could be putting those who are in treatment more at risk or even worsening the symptoms of those already affected by depression and anxiety. With this in mind, it can certainly be said that it's important for patients to be mindful of the effects of excessive screen usage. Diving a bit deeper into some of the negative effects of excessive screen usage, let's first look at sleep disruption. One of the most studied effects of screen usage is the delayed release of melatonin, a chemical within the brain that helps regulate our natural sleeping and waking clock. The blue light that emits from most screens can delay the release of this chemical, making it harder to get to sleep when scrolling close to bedtime. Scrolling on the phone or watching TV can also keep our brains active when they should be winding down, as well as simply distract us past our bedtime. Another negative effect linked to excessive screen usage is stress. This has been reported to be especially true for those whose screen time exceeds 4 hours per day. Most often, an increase in perceived stress is tied to social media use, as it can present social pressures and comparison behaviors that contribute to our overall perceived stress. More recently, decreased attention span has become a widely studied effect of excessive screen usage. In 2004, the average attention span when performing a task on screen was around 2 minutes and 30 seconds, and within the last few years, this has shrunk to an average of just 47 seconds. One aspect of digital sources that could contribute to this decrease in attention span is overstimulation. Many online sources are excessively attention catching, and this causes a fast and constant release of dopamine, the primary chemical that drives the brain's reward system. When screen usage becomes excessive and our brains become used to this constant release of dopamine, it can become harder to focus on other less stimulating tasks. This link between dopamine release and online sources is also a key player in the addictive behaviors tied to screen usage. While being online isn't necessarily an exclusively sedentary activity, we often engage with it in this way. For most people, most of the time spent online is stationary, whether that's at the desk on the computer, on the couch watching TV, or in bed on the phone. Especially for those with higher screen times, this sedentary time can add up and take up the free time that could be used for physical activity. Along with this, it's all too common to have poor posture when online, with most usually adopting a more hunched position over their computer or phone. This poor posture can contribute to back, shoulder, and neck pain. Finally, as we know, excessive sedentary behaviors without the appropriate amount of physical activity can contribute to various negative health effects. Whether you need to be on the computer for work or you simply wish to remain in touch with those around you, our digital age presents a big issue. For the vast majority, the use of technology and screen time has become a necessity. With at least some screen time being a necessity for most, how do we find an appropriate balance to minimize some of these negative side effects? Here are some strategies that could help you find the right balance between unplugging and being online. First, most smartphones allow you to track and view your screen time metrics. In most of the big brand phones, this is found within the settings and can be a great tool for helping you be more mindful with your screen usage. Setting a timer to avoid excessive scrolling or a daily screen time limit for yourself can also be fantastic ways to practice mindfulness when engaging with digital media sources. Many phones also allow you to place app restrictions, where you can choose certain apps to place restrictions on, such as limiting the amount of time you can spend on the app, limiting the amount of times you can open the app, and limiting the time of day that the app can be used. Of course, since our screens can have such a negative impact on our sleep, avoiding the phone, computer, or TV before bedtime is a great way to ensure a restful night of sleep. If you've already formed a habit out of scrolling before bed, a great replacement could instead be reading a book. For a good night of sleep, most general recommendations say to avoid the screens 1 hour before bed. And finally, don't let screen usage be a sedentary activity. Ride a stationary bike while you scroll on social media, keep your weights near the couch and use commercial breaks as exercise time, or get up to move periodically when working at your desk. Wrapping up our conversation today on digital wellness, I'd like to highlight that it's not all negative. Our phones, tablets, computers, and TVs can be fantastic tools for work, entertainment, and connectivity. It's really just all about using them effectively. Remember that some screen time is necessary, whether that be on the computer at work or just unwinding with your favorite show after a long day. When used in moderation, social media is a fantastic tool for keeping us connected with those close to us. Digital wellness is less about cutting out screen time completely and more about using our screens more effectively. Thank you for being part of our conversation on screen time and digital wellness today. I hope the information we've covered has brought you some clarity and comfort. Your health and well-being are what matter most, so please continue to take care of yourself, stay informed, and remember that hope is always present. Now, let's transition into some gentle movement to further support your journey.
Hey, I'm Morgan, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to our 6-week program to improve your cardiorespiratory endurance and range of motion during and after lung cancer treatment. This program is a beginner-friendly routine that will incorporate breathing exercises and stretching in the warm-up and cool-down, and a HIIT-style workout to increase your heart rate. The structure will be similar each week with varying times and sequences for the workouts. During the workout, it is important to sit up tall with your shoulders back, keeping your core engaged, and continue moving through the entire workout. Please speak with your surgical team if you have exercise restrictions and if there are certain movements that need to be avoided. For this week, all we need is a stable chair. The following exercises are meant to be pain-free. If you notice any pain, please stop and discontinue the movement or continue to move in the range of motion that is pain-free. There may be some discomfort, especially after surgery, but there shouldn't be any pain. As designed, this program is meant to increase your heart rate, but if you feel lightheaded or have difficulty catching your breath, please stop and rest before continuing. So we are going to start with our warm-up. It's going to be about 5 minutes long, and our first movement is going to be our diaphragmatic breathing. So what we want to do is place our hands on the bottom of our ribs, or we can have one hand on our belly and one hand on our ribs. And what we're going to do is take a deep inhale into our belly, expanding our ribs out, and we are going to take 5 breaths. As you're breathing out, you should pretend that you are breathing through a straw. So nice pursed lips. You should be able to feel your belly pushing onto your hand and also your ribs coming out in that 360 breath. We're going to move on to our cross-body shoulder stretch, and we're going to do 2 stretches on each side. And so what that's going to look like is we're going to have our arm across our chest, going to put our hand on our forearm by our elbow, and just pull that arm gently across, getting a stretch in our shoulder. You can hold it for about 5 seconds and relax. We'll switch to the other side. Same thing, hand by your elbow, pulling across your chest. Hold for 5 seconds. Relax. Opposite arm, hand across the chest, hand by your elbow, pulling into your chest until you feel a good stretch. And one more time on the opposite side, hand on elbow, pull across your chest, and relax. Our next movement is going to be shoulder rolls. So what we want to do is pull our shoulders up, pull them to the back, push them down, and then come to the front. We are going to do a set of 10. So try to sit up nice and tall. Don't let your back rest on the chair. Keeping that core engaged, and nice slow rolls, just getting that full range of motion with our shoulders. If you feel some pain or discomfort during this movement, just make your shoulder rolls a little bit smaller to the point where you don't feel any pain or discomfort, but you still get that benefit of the range of motion. And we'll do a couple more shoulder rolls here. We are going to move on to our wrist flexion, and so we are going to put our hands out to the side and just have our hands up towards the ceiling, and then we're going to flex them down towards the floor. And so we're going to do 5 on each side, up and down. Remember, we're still sitting up straight, keeping that core activated. Nice and slow movements, feeling that stretch in our forearm. And then we are going to come to the front, in front of us. And you can have your second hand, take one arm, one hand out in front, and pull those fingers back towards your elbow, just for a little extra stretch. If this is something that doesn't feel great for you or is painful, go ahead and just skip this part of our wrist flexion and extension. All right, after we finish our 10 wrist flexion and extensions, we're going to do our prayer stretch. So hands together on our chest, and they're nice and flat, elbows up, shoulders down, core activated, and for about 3 to 5 breaths, we are going to pulse our hands together by pushing our hands together, activating our chest muscles and relaxing. So you're going to go 1, 2, 3, right, relax, and we're going to do these for 10. So these are nice isometric presses for our chest, warming up our shoulders, chest, and back, getting ready for our HIIT workout. Don't forget to breathe through these exercises. We don't want our heart rate jacking up just yet. All right, and that is the end of our warm-up. So we're at the HIIT portion of our workout. What we're gonna do is work for 20 seconds and then have a 10-second rest. We will go through each movement 3 times, equaling a minute and a half of work for each. Our movements today are overhead press. So our arms are out to the side, driving up overhead, trying to get our biceps to our ears, keeping our core nice and tight and having good posture. If this movement is painful for you or you have limited range of motion, just stay in that range that you can, even if that means that our arms are slightly underneath our shoulders, just moving through and getting that press up overhead. Our next movement is high knees, and so we will be raising our knees up to our chest as much as we possibly can. And so if that means that we are just raising our foot up off the floor a couple of inches, that is totally fine. So our goal is to keep our core nice and activated. You can put your hands on your belly and make sure that you are breathing and bracing while we're moving our feet. Our next movement is cross-body punches. So we will have our arms up in front of us. You can make a fist, you can have flat hands, whatever your preference is, and you're going to cross punch across your body, and you are trying to maintain a stable core and an upright back. Our next movement is seated dead bugs. This one's a little bit tricky. So we will be raising our knee and our opposite arm at the same time. So opposite arm, opposite leg, and then opposite arm, opposite leg. Again, if you have limited range of motion and you can just reach a little bit, raising that foot just a little bit, or even, keeping your arms in a stable position while you're alternating with those knees. Our second to last movement is shoulder blade squeezes. So arms at your side, next to your ribs, and you want to squeeze those shoulder blades into your spine, keeping those shoulders down. So again, we're sitting upright, squeezing and relaxing. Our last movement is seated hamstring curls. We are going to be using one foot at a time. You can put your hands on your hips, and you're going to pull your heel towards the bottom of your chair. This may have an intense feeling, but that's absolutely okay. So again, pull as much as you can. You should have a nice activation in your hamstring as you're doing this and staying upright with that core. All right, we're gonna get into our workout. We will be starting with our overhead press, arms up, elbows at your side in 5, 4, 3, 2, 1, and drive up overhead with those arms, keeping your shoulders pressed down. And I want you to exhale as you're driving up overhead as if you were breathing through a straw. We have about 5, 4, 3, 2, 1, and rest. And this is our rest period, starting again with our work in 3, 2, 1, go. Same movement. As you get tired, keep pushing those shoulders down and keep that back nice and straight. 3, 2, 1, and rest. If you feel like your shoulders are getting tired, you can add in some shoulder rolls. And last set. Go. 1. We got 20 seconds of work, and then we are done with our overhead presses. So just keep it moving, 10 seconds left. 5, 4, 3, 2, 1, and rest. All right, so we have our 10-second rest, and then we're gonna have about 30 seconds to discuss what our next movement is, just in case we've forgotten already, which is totally okay, because I've probably forgotten too. Our high knees or alternating marches, and we will be beginning that exercise in about 15 seconds. So if you need a quick drink of water, go ahead, take a drink, and we got 10 seconds left. Remember, our high knees are lifting up one knee at a time towards our chest, not letting us sag. And 20 seconds. And put your hands on your hips, keeping that chest up. Exhale as you bring that knee towards your chest. 3, 2, 1, and rest. Whew. Take some deep breaths as your heart rate is starting to increase. Try to fill that belly. And go. Second round. Remember, if you feel any pain with this, limit that range of motion, or if you are having pain throughout this entire movement, move on to the next movement. And rest. We have 5 seconds and our last round. And go. Keep it moving as we get tired. Keep trying to push through, bringing those knees as high as you can, that is comfortable, back straight, core engaged. 3, 2, 1, and rest. All right, great job, everybody. We will be moving on to our seated dead bugs. We have about 30 seconds until we start those. As a reminder, our seated dead bugs are opposite hand and opposite leg. So we will be doing that overhead press plus our alternating high knee march. We got about 15 seconds, so if you need to practice alternating each side, opposite arm and leg can be a little tricky. We'll be starting in 3, 2, 1, and go. If this is a movement that you feel really unstable with, you guys can pick to limit your range of motion until you feel a little bit more stable. We got about 10 seconds left, and rest. Three, two, one. Opposite arm, opposite leg, sitting up nice and tall. Exhale as we bring that knee to our chest. Got 10 seconds. 3, 2, 1, and rest. And we have one more set of those seated dead bugs. Starting in 3, 2, 1, go. Try to take deep breaths and push through that muscle fatigue. That's where we start to increase our strength and our resiliency. And rest. All right, 2 movements left. Our next movement is our shoulder blade squeeze. So remember, chest up, elbows at your side. We're going to be squeezing our shoulder blades into our back, keeping our shoulders down. We will be starting in about 15 seconds. Try to take some diaphragmatic breaths, getting all the oxygen into those lungs, trying to bring your heart rate down just a little bit before we start. And 3, 2, 1, go. So we are squeezing those shoulders together and relaxing in the front. Keeping our core nice and tight, and push those shoulders down like someone has their hands on your shoulders and you're trying to move them without coming up towards your ears. And rest. All right, 3, 2, 1. Remember, try to keep those elbows close to your ribs as possible and only move in the range of motion that is not painful. All right, and rest. We got one more set of those shoulder blade squeezes. 3, 2, 1, and go. You got it. Keep it going. We're almost there. 10 seconds left. 3, 2, 1, and rest. Okay, we are on our last movement. So we have our seated hamstring curls, and what those are going to look like. Hands on your hips. You're going to lift your foot up just slightly off the ground, and you're going to pull that heel towards your butt or towards the bottom of your chair as much as you can. So if this is an intense Charlie horse feeling, that's okay. But if you have any pain with this that doesn't feel normal, then you can go ahead and skip this. We have 5 seconds and 3 rounds left of our hamstring curls. And go. Again, keep your posture nice and upright, shoulders back and down. And we got 3, 2, 1, and rest. We got 2 sets left. Taking deep breaths and go. These movements can be nice and slow. They don't have to be fast. As long as you're getting that good contraction, you are doing the work. Got 5 seconds, 2, 1, and rest. All right, last set of our HIIT workout for today, and then we are moving on into our cool down. And go. Keep it moving, 10 seconds. 5, 4, 3, 2, 1, and rest. Great job getting your HIIT workout in. Take a minute to bring your heart rate down, and we will get into our cool down and our stretching. All right, we are gonna start our cool down. It should take about 5 minutes, and we will start with our cross body shoulder stretch. So just like we did in our warm up, you're gonna take your arm across your body, hand just before your elbow, and pull that arm into your chest until you feel a nice, pleasant stretch. And you can stay there for about 10 to 20 seconds, depending on how it feels. And then we will switch. We will go through this. We'll do each side twice. Getting that nice shoulder stretch in. And again, we want to maintain that upright posture, keeping our shoulders pulled down and bracing our core. All right, we are gonna move on to our overhead reach, and we will add in some front and side stretching with those reaches. So we are going to come with our hands down to the side, reach out, and come to our ears, and then back down. And we will do each 2 times. Again, reaching overhead, keeping our shoulders pushed down, and coming back down. Next, I want you to just do one arm stretching overhead, and I want you to stretch to the side like someone is pulling your hand that is towards the floor until you feel a nice stretch. If you feel any pain with this or unpleasant stretching feelings, go ahead and skip this. All right, one more time with that side stretch. You'd feel a nice stretch in your torso. Sitting up nice and straight. Our second to last stretch is our hamstring stretch. So we are going to put our foot out in front of us as straight as you possibly can, and we're going to sit up straight, hands out in front, and bend at those hips. If you feel like you're bending in your lower back, we want to pretend that there's a pull up your back so you can't physically bend in your spine. So hands out and hinge at those hips, stretching towards that foot. Once you feel a nice stretch in your hamstring, you can stop. You don't have to touch your toes. Just go as far as you can with a comfortable stretch. And we'll hold it for about 10 to 20 seconds and come back. We'll do the next leg. Same thing, leg out, and hinge at those hips, keeping that back nice and flat until we feel that nice stretch in our hamstring. Don't worry if you can't get your leg completely straight. That is okay. We are just moving in that range of motion that is comfortable for us. And we're gonna do it one more time. Remember, hinge at those hips, keeping that back flat. Sometimes keeping your head up, looking towards the ceiling, helps us keep our back nice and flat in the proper position that we want. And relax. Our last stretch of the day is our figure 4. So what you're gonna do is take one leg, lift it up on top of your other knee, and just kind of let it sit and relax. This should be stretching out your hips and your glutes. If this is a very comfortable position for you, you can even lean forward with that straight back into that knee. If you're having trouble lifting that foot up on top of your knee, you can move that foot out, the opposite leg out, and have that foot a little bit lower on top of that knee. And same thing, leaning forward with that straight back, hinging at the hips, and getting that nice stretch. And so we'll do that 2 times on each side. So again, you can also assist your foot with getting up over your knee, leaning forward, chest out, getting that nice glute and hip stretch. If you feel like it's too stretchy, go ahead and move that foot out just a little bit, decreasing that angle and still getting that nice stretch in your glute. All right, that is the end of our cool down. Thanks for joining me. Can't wait to see you next week.